Hey everyone, welcome back to my channel. Thank you so much for clicking on this video. If you're new to my channel, my name is Nurse Melissa. This is Merlot, and I am a registered nurse. So this is going to be a super informal video talking about my first week as a nurse in my nurse residency program. For those of you guys that have not seen my previous videos, I am a brand new nurse. I just finished my first week as a nurse and I'm really excited. I live in Maryland, so I'm in the DC metropolitan area, and I'm in a DC suburb. I'm in Maryland. And I am now working for one of the major hospital systems in the DC metropolitan area, in my area. And I'm starting off as an ICU nurse. I am in a nurse residency program, and I do plan to make a video talking all about nurse residency programs, because just a side note, I think that all new nurses starting out at the bedside should go through a nurse residency program. There's so many benefits to it, so I will make a video dedicated to that. But I only applied to hospitals, and I only looked at hospitals that had a residency program. And the hospital that I ended up choosing for my current job has an amazing nurse residency program. And so I just finished the first week of my program and of my first job. And I'm really excited. I feel like I picked the right hospital. I feel like I picked the right organization because it is a hospital system. So they have multiple hospitals. But the culture of the organization just seems so healthy. Everyone in my cohort seems friendly. All of my instructors, and not my specific preceptor because I haven't met my preceptor yet, but everybody working in the program just seems so friendly, so eager to teach. Everyone in my cohort seems so eager to learn. I feel like I'm already making friends, and after my first day, really during my first day as they were talking to us, because we were kind of like in a classroom setting, I just had this feeling of, thank God I chose this hospital. I made the right decision. So far I am very happy with the hospital that I chose. I have not touched the unit yet, so I haven't started seeing patients yet, but I feel like by the time that I do start seeing patients, I will feel comfortable to do so. So for my first week, I worked all 5 days. So I worked Monday through Friday, and it was like 8 a.m. to 4 p.m. So it was like 40 hours this past week pretty much. And I was in a classroom setting. So the very first day I was in the classroom with everybody that was starting out in this organization. So it was not just nurses, like there were secretaries there, like anybody that's new to the organization. This was a general orientation. So anyone starting off this summer had to attend this orientation. So most of it was nurses in the nurse residency program. Some of it were nurses that were not new and they were new to the hospital. There were like secretaries and instructors. So day one was just a general orientation, and we had different people from the organization come and talk to us about the culture of the organization, different policies. They spent a long time talking to us about like benefits and different HR stuff, like different policies and things like that. So day one was a general orientation for everybody. And then day two was a general orientation for all of the nurses. So again, most of the people in day two, everyone was a nurse. Most of the people were brand new nurses, like in my nurse residency program, like new graduates. But it was any nurse that was starting off at the hospital. So even anyone that had like 10 years of nursing experience, but they were new to this hospital organization, they also attended nurse specific orientation. And so for day two, it was a full 8 hours in a classroom setting. We had certain nurse leaders in the organization come and talk to us. We learned about different policies that were specific to nursing. And it was just geared towards all of the new nurses starting out. We went over different policies, timesheets, pretty much anything that a nurse starting off in the organization would need to know. We did that. And we did do some organizational culture stuff, which I love stuff like that. I'm very extroverted. So anytime that there's like a group activity or like those icebreaker things, I really like them. So we did all of that on day two. So the first 2 days, even though we talked about certain policies, it really was not like healthcare related. Like it wasn't super direct patient care. It was really just going over different organizational things. Day 3 of my orientation was orientation for the nurse residency program. So like I said, day one was anybody new starting off in the organization. We went over like different organizational policies, HR stuff, benefits, PTO, all of that stuff. Day two was specific to all of the new nurses that were starting off, and so like nurse specific policies, documentation, things like that, and just like how like our time would be divided up on the units and stuff like that. Day three was specific to the nurse residency program. So all of the veteran nurses that were new to the organization and new to the hospital, they were eliminated, or not eliminated, but they didn't have to come to day three. So day three was only consisting of all of the new grad nurses through the nurse residency program. So for day three, we were again in a classroom setting. We did not touch the unit, and we reviewed signs and symptoms of sepsis, how to see when a patient is going into septic shock, how to document this. We learned about the same things involving strokes. We learned about all the different codes that we called in the hospital, things like that. And then we also learned about just like the nurse residency program and kind of what was to be expected from us within the program. So it really was an orientation for the nurse residency program for like the first half of that third day. And then the second half of the third day, we started learning about the electronic medical records software that the hospital uses. At least in my area, most hospitals either use Epic or Cerner. And so that was what we got training on. We got training on the EMR software, the electronic medical records software, during the second half of day three. Day four, the entire day, we were on the computer with continued training for the electronic medical record software that we used. So they spent a lot of time going over that software, how to document in that software, how to write orders, accept orders. We learned about how to pull information from the EMR software, how to enter in information from the EMR software, how to look for things. It was so extensive, and I'm happy that it was, because I feel like I really got a lot of experience practicing documentation and learning how to use the software, which is going to be a very important part of my job. I feel like there are two halves of nursing. There's the patient care, and then there's documentation. And no matter how good your patient care is, if you don't document it, it did not actually happen. So I'm glad that they took a lot of time to really teach us how to use that software. We also had a little bit of time to, well, not a little bit, we had more than a little bit. We had time to do our online modules. So we have these modules that we have to do online. There was training for the EMR software that we're using online. And then in addition to that, there was training on different hospital policies. There was training on how to use the Pyxis, which is, if you're not familiar with what the Pyxis is, it's like where all the medications are stored. And so we had training on how to use the Pyxis to retrieve medications for patients. And all of that was in days 3 and 4. Day 5, which was the last day of the week, my final day of my first week of orientation, that was skills, which I loved, our skills day. So we came in the morning, and for the first half of the day, we were split up into groups, and there were different stations, like different classrooms that we would all kind of rotate through. One station was the BLS station. So we had a mannequin and we had a nurse instructing us how to respond to a code if a patient goes into cardiac arrest or they have no pulse and they're not breathing. And so we simulated, pushing the code button, calling for rapid response. We acted out being rapid response. We were giving out chest compressions. And it was a great refresher. Even though we're all BLS certified, we all have CPR training, it's good to do it like in a simulated hospital setting and knowing where the crash cart is and what to grab off of the crash cart and just how to respond to that type of scenario. We also had training on how to do a sterile dressing change on a central line, which is something that we kind of learned about, at least I did, in nursing school, but obviously we weren't able to do it because it is very high risk. There's a high risk of infection. So we got to practice how to do a dressing change for a central line, which is really important, especially for me. I'm going to be in the ICU. I learned how to start an IV. So we had a station on how to start an IV, and there was this really cool simulation where they had like simulated skin, simulated veins, and we used real needles and started an IV and were able to draw simulated blood. I thought that was cool. We had a station on EKGs and how to do an EKG, like where to put the leads on patients. So it was extremely hands-on. I had a lot of fun doing it. Oh, we also did AccuChecks, which is, for those of you that are not familiar, AccuCheck is a specific brand of a glucometer, so checking blood sugar. And so we learned how to, well, all of us knew how to do it because we'd done it before, but we reviewed how to do AccuChecks on patients and specifically how to do it at that hospital, like their policy and their method of doing things, because every hospital is a little bit different. So that was the first half of the day. We were rotating through stations and I had a lot of fun because I love doing hands-on stuff. And then the second half of the day after lunch, we went back into the classroom, and it was essentially like we got I would say like a lecture type of thing. One of the nurses had a PowerPoint slide and we were learning again about the different signs of sepsis and infections in patients, the hospital's policy, how to do certain things, how to ambulate a patient with certain mobilities or comorbidities. We learned about different hospital policies and different ways of identifying and documenting very high risk things going on with patients like sepsis, stroke, ambulating patients. And then throughout the week in our classroom sessions, like when the nursing cohort was in the classroom, we also reviewed things like how to clock in and out. So like basic organizational things, how to clock in and out, how to request time off. We got set up with an organization email, just pretty much everything you can think of from an HR standpoint. We kind of were doing that the first week of our orientation. And so that was it for my first week of orientation. I also got my schedule for the next month, I think month and a half. And so I have already been assigned a preceptor, which I'm really excited about. I know my preceptor's name, but I have not actually met them yet. I'm not going to meet them for like another week and a half. Next week, I'm going to be working, not every single day, but on the days where I am working, I'm going to be in my scrubs and I'm going to be going over like fundamentals. So I'm not actually touching the floor. I think I'm still going to be in a classroom setting and we're going to be going over different skills. And then in my third week, that is where I'm actually going to meet my preceptor and to go up on the unit. So I'm very excited to meet my preceptor. I'm really hoping my preceptor is friendly. So far, everyone at the organization has been so friendly. And like I said, I do plan to make a completely separate video talking about nurse residencies, but I will just say I am so happy that I selected the hospital that I did and the nurse residency program that I did. Even when I was talking to people in my cohort, my nurse residency cohort, like at lunchtime and stuff, they were telling me about how they had friends that started at other hospitals, even in nurse residencies, and they only had like 2 days or 3 days of orientation and then they touched the unit. I am not touching the unit until my third week of orientation. And to be honest, I am very happy about that. They also spoke to us and said that orientation can last anywhere from like 12 weeks to 20 weeks. It depends on what unit we're on. It depends on like us as individuals. So it seems like if it seems like somebody needs extra time through orientation, they will give them extra time. So it's not like everybody on one unit has like 16 weeks of orientation and then after that it's done. If somebody at that 16-week mark seems to need a couple extra weeks, they will give them that. So they'll give them that grace. And I love that. I feel like I really wanted a program where someone was going to be holding my hand, and I feel like that's exactly what I got. Even the fact that we had a full week of orientation in the classroom, and literally any question that you could think of for an organization, they were able to answer it. They took their time answering it. Our EMR software training, even though some people were familiar with electronic medical records, apparently in my hospital for every unit it's a little bit different because you document different things. So for people in the ICU like me, nurses in the ICU, our interface is going to look slightly different than the nurses that are in the emergency room because they're going to be documenting different things. So I feel like my organization really took time to go through each unit, what we're going to need to document. And so even for people that are familiar with that EMR software, you can always learn more. So for me, I'm really happy. I'd rather have a super long, extensive orientation, and by the end of orientation, I'm like begging to be on my own, than to have the opposite where they give us like a week of orientation and then we're off on our own, or we're off with our preceptor and I'm asking for more help. Like I want a situation where by the time, like I want to be ready to let go before they're ready to let me go, if that makes sense, like let go of holding my hand. So I'm very happy. Also in my area, I don't know about everyone's area, but we are kind of, I don't want to say monopolized, but there are a bunch of different hospitals and hospital systems in my area, but I would say that there are like maybe 4 or 5, I would say like maybe half a dozen major hospital systems in the Virginia, DC, Maryland area. There are probably like half a dozen major hospital systems, and a few of those are more faith-based. And so I did go with one of the hospital systems that are more faith-based organization. And so they were talking about God. We did have morning devotionals in our orientation. I know that's not everybody's thing. I don't really talk about it a lot on my channel, but I am a Christian. And so for me, even just that first day they did devotional, just the fact that people at my organization are not afraid to talk about religion, they're not afraid to mention God's name and talk about healthcare from like a spiritual aspect. For me, that aligns with my personal values. So for me, that was, I just feel like I could not have picked a better hospital. Like once they started talking about that and they were comfortable talking about it, I looked around and everyone in my cohort, everyone seemed to kind of have their own faith, whether that was Christianity or something else. Like it just felt, it felt special. It felt really warm, and I just felt like I was in the right place. So even though it's only been a week in, I feel like I had a great first week. I feel like I picked the right organization. I'm very happy with the pace of my nurse residency program, and I'm really excited to continue. So that is it for this video. It's just a pretty basic rundown of my first week as a new grad nurse through my residency program. And I will make a video after next week talking about what I did in week 2 of my nurse residency program and orientation. What's on my calendar is that we're just going to be going over fundamental skills, but I'll go ahead and make a video on that. And I do plan, like I said, to make a totally separate video on nurse residency programs and what to look for when you're applying to new nurse jobs. I feel like a lot more hospitals are coming up with nurse residency programs. Like they're just kind of popping up everywhere, because I think it's just becoming more popular. Like I personally would not advise a new nurse to start off at the bedside unless it was through a nurse residency program. And I feel like that's kind of getting around. So hospitals are hearing that new nurses like residency programs, so they'll just kind of create one without putting any checks and balances or without really properly structuring it. So you could start at a hospital that says they have a great residency program and then you go there and it's not good. So I do want to make a video on what to look for and what questions to ask in your interviews to make sure that you're properly vetting the hospital and properly vetting the nurse residency program to make sure that's actually good. Because I honestly feel like a good program can make or break you as a new nurse. And I see a lot of people starting off in the profession getting burnt out or bullied, and that's because they did not go through a good nurse residency program. So that is it for this video. If you liked it, please give it a thumbs up and subscribe to my channel. If you have any questions, you can go ahead and comment down below or shoot me an email. I always put my email in the description box. Thank you guys for watching, and I will see you in my next video.